exams all the time, and it's called the thoracic duct. The thoracic duct. It's named for its location. It is primarily a thoracic, large lymphatic vessel. It is filled with one-way valves. It is filled with one-way valves, and it is the longest, largest lymph vessel in the body. You feeling pretty good? Okay, I'm sorry. Yeah. It's sad when you make the effort and you come and then you feel really great. Yeah. Okay. Well, be very careful. You want somebody to go with you? Well, why don't you wait until she comes get you?
Well, she's on her lunch. I'm just calling and ask her to drop her home.
Okay.
I'll call her, so we do.
Okay now.
I'll email you, ask you for anything I need.
Okay, all right, bye-bye. Well, now, underneath the diaphragm, we have the one structure of the lymphatic system, and it's called a cistern. Now, we learned the word cistern in 210 for terminal cisternae. This is a structure that's got a bunch of stuff in it, okay? Well, what's in this cistern is lymph, okay? It's called chyli. The cisterna chyli. So this cistern, the cisterna chyli, is underneath, inferior to your diaphragm, okay? It is filled with lymph fluid from the area inferior to the diaphragm, which is most of your body, actually. So most of the lymphatic fluids are going to go into the cisterna chyli and the thoracic duct. Some books just say 2/3. Some books say 3/5. I don't know what your book says. Doesn't matter. 2/3 good enough. All right. So what I'm going to do is I'm going to use my little extra light here. Pretty cool. And we're going to look at the thoracic duct. Okay. This is the thoracic duct. It is by far the longest, largest lymphatic vessel in the body. Okay. We see that this is going to dump lymph into the left subclavian vein. It dumps the lymph into the left subclavian vein, so that right before the blood goes back to the heart, we have regulated its viscosity and maintained it before it enters the pump. 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 This way we don't end up with cardiac arrest. That's a very sad day. Okay? Now, as we move down, and of course here's the diaphragm again. See the diaphragm, here's the right lung, there's part of the left lung that's been cut out. Okay. So as we continue to come down, 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 down. Wait a second, I'm on crack cocaine today. This is the diaphragm. So that's the thoracic area. We already said that earlier. Here is the diaphragm. Okay. You don't have any liver in this model, but you can see your stomach. So anyway. So here is the thoracic duct coming on down, coming on down, coming on down, and then, let's see. There. That should be good. The liver's been moved over here, but it's really here too. But anyway, you see the thoracic duct. And then there you see the big cisterna chyli. Okay. So here we see this reservoir of lymph, it's the largest reservoir of lymph in the body, and it's underneath the diaphragm. Now, of course, this is all the thoracic area. Here are your lungs, and there's the thoracic duct. Now, if we look at this and we come up here, oh, wrong thing. We see the heart has been removed. But we know that the central tendon right here of the diaphragm, that the inferior vena cava goes through the diaphragm and it goes down, down, down on out of the thoracic area. Okay, and you can see that on Fred. Bring Fred over here. So here is the inferior vena cava, here's the diaphragm, and there's the vena cava hiatus that we did in 210. So you have the diaphragm, and then you have the inferior vena cava that is immediately underneath, inferior to the diaphragm, a small part of the thoracic duct, and then the cisterna chyli is inferior to the diaphragm. Okay. Now, superior, we have the superior vena cava, which is on the model here, attached. And then we have the brachiocephalus, okay? And of course, these are large vessels themselves. And so we have a supply of blood that is inside the large veins above and below the diaphragm. And we have the thoracic duct that is above the diaphragm, and we have the cisterna chyli that is inferior to the diaphragm. Now, all of these are easily collapsed or pulled apart under pressure. Okay? Now, to explain this, we got to talk about the respiratory system too. There's no way to do this without having a little bit more information. Now, if we look at Fred here, we look at the diaphragm. We said in 210 that the diaphragm inserts on itself on the central tendon. So when the diaphragm, the umbrella, contracts, it does this. Okay? So it's like this at rest. When it contracts, inserts on itself, it does that. Now as this diaphragm goes down in an inferior fashion, the volume in this area is increased and the abdominal volume is decreased. Now pressure and volume are going to be related to each other. So as the pressure goes up, okay, in an area, here let's just draw it, it makes more sense. So if we look at the body, and here's the diaphragm, okay, as this goes down, as the volume goes up, the pressure goes down. So these are inversely related to each other, okay? But as the volume goes down, the pressure goes up. So as the diaphragm goes down, let's go ahead and draw it in the down position here, okay? Then this volume went up, but the volume went down. This is the thoracic cavity. And this is the abdomen pelvic cavity. So the volume goes down, and so the pressure goes up. Now this is responsible for all the kind of things too. Okay, but this is just a simple, the inverse relationship between pressure and volume. So as volume goes up, pressure goes down. As volume goes down, pressure goes up. Okay? So they are inversely related to each other. Now, this all presupposes that we remember Bio-210 body cavities. That the ventral body cavity is divided into the superior, by the diaphragm now, the superior called the thoracic body cavity, and the inferior called the abdominal pelvic body cavity. Okay, do you remember that? Okay. Good. All right. So these body cavities are non-metabolic body. They do not have to maintain a set pressure or volume. And we see that because they are non-metabolic, that we are going to dramatically change the pressures with every inhalation and exhalation of our lives. Okay? There's several songs about every breath you take and stuff like that. But anyway, so every breath you take, we can use this for anatomy now. So every time we inhale, we are increasing the volume of the thoracic body cavity, i.e. decreasing its pressure. And as we inhale, we are decreasing the volume of the abdominal pelvic area, and we are increasing its pressure. Pretty cool. Pretty cool. Now, if you're a lymph vessel or a large vein, will you respond to these pressures? That's the question. Katie says yes. Amen. You're going to respond to these pressures. So if you are pressurized and you have one-way valves, then you will collapse and move that material in one direction only. And that direction, whether it's the lymph system or the cardiovascular system, is the same. It's to the heart. 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 So when you inhale, you collapse the cisterna chyli and the inferior vena cava, and both of them will move the blood up towards the heart. But as you inhale, you pull the superior vena cava and the brachiocephalic veins and the thoracic duct, you pull them apart because they were just collapsed when you exhale. Oh, this is cool now. Once you see this now. So it's in and out for all these large vessels. As you pressurize, whether it's the thoracic or the abdominal pelvic, it doesn't matter. Whenever you pressurize one of these body cavities, all those large vessels that they all have one-way valves, you collapse them down. The blood moves to the heart, moves towards the heart. When you depressurize them, it pulls them back apart. Blood has adhesive and cohesive properties. So does lymph. This means that the fluids that are in the vessels, are moved through one-way valves back into the large vessels, whether it's the lymphatic vessel or it is the vena cava or brachiocephalic veins. Now we do this about 14 to 16 times per minute at rest. So the respiratory pump is it's seldom discussed, for whatever reason, I don't know. But it's a huge aspect of lymphatic and venous return to the heart. Now remember, your diaphragm is a skeletal muscle. So when you talk about skeletal muscle activity and venous return, you must discuss the diaphragm. You got to talk about it too. So you got to talk about your diaphragm. Isn't that pretty cool? It is cool. Right? So that is the respiratory pump. Now, as we look at this picture model of this individual, I don't know. It's hard to say. Is it supposed to be male or female? Hard to know. But anyway, we see all of these white lines, and then we see these little yellow golden pearls. What might they be? Well, these are lymph nodes. Now, the lymph node is the most common organ. In fact, really, it is the organ of the lymphatic system. And there are a lot of them. Now, lymph nodes are found in series One lymph node will go to another lymph node, 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 so that we can do the purposes of the lymphatic system. We'll write those down in just one second. But it turns out that we have what are called aggregates. We use this word with platelet aggregation, where we have many together in one place. Many together in one place. This is what aggregate means. So when we look here at our model, we find that the axillary cervical areas on this individual have aggregates of lymph nodes. Sometimes when they get infected or whatever, you'll feel this swelling in your neck, okay? Or you get this pain right in here, you know? And this is where we have these aggregates. Now, sometimes you can become overpowered as a lymph node. And then there are certain cases you got to just cut them out of there, you know? You just can't clean them up. But anyway, so this is the right axillary lymph node aggregate. This aggregate up here, can't see it, sorry, is the cervical aggregate of lymph nodes. Here's the left axillary aggregate of lymph nodes. Now as we come down, we come to some words that we may not know, but they're still what they're called, so we have to learn a word here. When we look down in the abdominal pelvic area of the body, it turns out that we have a doubling of serous membrane. This double serous membrane is called mesentery. Mesentery. Now I'm sure that most of you have heard the word mesentery before, you know. But mesentery is a very specific word of the doubling of peritoneum, serous membrane, found in the abdominal pelvic area of the body, this body cavity. And we're going to see now that mesentery will provide routing of nerve, artery, vein, lymphatics to the organs of digestion. Okay, so we're going to come back to this when we do digestion. And many of the mesenteries have a specific name. And so we'll learn the names as we go. But the most general term is just the word mesentery. Okay, just mesentery. And so we have to know that word because one of the aggregates on the body, of course, is mesentery. Okay? So as we come down here, we find the mesentery, and we find all of these lymph nodes associated with the mesentery. Okay? And then we have other aggregates, but the only other ones we do are inguinal. I don't know if this will go all the way down or not. This is the inguinal. There's your rectus abdominis muscle cross section there. But anyway, so that is the right inguinal aggregate of lymph nodes. So we got all these aggregates. There's a added one too, but we don't do that. So we're going to do inguinals, mesentery, axillary, and cervical aggregates of lymph nodes. That's it. Okay, there might be more than that on the handout, but I don't care. That's what we're going to do. Okay, so that's it. So the sternochyli, the thoracic duct. Now, the thoracic duct goes into the left subclavian. This means that we must have something else going into the right subclavian. Okay? And so as we look at this, we have, this is a big model. So here we have the right subclavian, and here we have the right lymphatic duct. The right lymphatic duct. Now, it has the word lymphatic in it. The thoracic duct does not have the word lymphatic in it. Okay. Now, this brings us to the word afferent and efferent vessel attachment to each node. Each node can have multiple afferent hookups. Here we see two afferents going into this. Maybe, I don't know, that's kind of confusing, it's hard to tell. But here's an afferent, there's an afferent, and here's an efferent. Efferents are going back to the main largest lymphatic vessel. Afferents are going to the duct itself. So, going to the lymph node itself. So here we see this white vessel is going to this lymph node, okay? So that's an afferent vessel for this lymph node that's going to it. This lymph node, when the fluid has been evaluated, is sending the materials into this large vessel right here, which is going right over into the right lymphatic duct, okay? So this has to be efferent. Remember now, just like afferent subdivision of the nervous system, sensory, okay? So going to and from the actual lymph node itself. Let's see. I think that's about all we do with the lymph system. Now, as far as the model is concerned. Now, let's erase that. Let's go back to the book.